Right. So, hello everyone and good evening. Welcome to this session for the aspirants of the NEET-SS and INI-SS entrance examinations. So, let me tell you at the outset that this is a very focused session on planning for the last 2 months before NEET and INI. So, this time we have got NEET and INI pretty close to each other, separated by just a gap of 2 weeks. So I think in the last 2 months, it is very important that you should have a dedicated preparation strategy for this. Okay. So let us actually start this particular session. And with me, I've got Dr. Karthik, endocrinology faculty at DocTutorials. So Karthik, welcome.
Thank you, sir. Thank you.
Yeah. So Karthik, I think, we have a presentation as well, and we have decided that this will be a very focused session, only focusing on the frequently asked questions, because I am also getting many queries from the aspirants. I'm sure that you also would be getting. I think we'll address those queries because time is very precious for everyone, and I think especially for the aspirants as well. So I think, Karthik, we'll get started now. Can you please share the screen?
Okay, sure, sir. So I hope the slides are all visible.
Yeah, you can make it full screen.
Yeah, okay. So hi everyone. And as Rahul sir has pointed out, we have just exactly almost 2 months before the NEET-SS, which is tentatively scheduled on November 7th and 8th. So we have to accept that reality. We have 60 days at our disposal before we are good to go for the exam. So as you know, exam will be highly competitive with the number of students giving the exam increasing year after year, and the syllabus is extremely vast. Now in the yesteryears, we have seen the questions not entirely from the Harrison, but of course around 60 to 70% would be direct picks. So I have to agree that the syllabus is vast, and in the remaining 8 weeks prior to the exam, we have to focus on revision with special emphasis on high-yield topics. So in the last couple of months, it is not about how much you study more. It is how smartly you revise, because you have almost every one of you have assimilated enough information. It is important on how well you are able to reconcile and revise that information. So as
I think one point I just want to highlight in that particular slide that Dr. Karthik has pointed is that syllabus is vast and all of us should humbly accept that. Yes, for the last 3 years, you might have been in the medicine wards. If you are a fresh pass out, you might have read a lot, you might have done so many presentations. But having said all that, the syllabus is vast. And see, as I always tell students, do not aim for perfection. Sometimes what happens is that, when you see that huge pile of portions in front of you, you feel that you have covered so little. But as Dr. Karthik said, it is important to focus on the high yield topics. And let me tell you, if you ask me what are high yield topics in a simple language, if me and Karthik are competitors attempting for an exam, what Karthik is likely to know, I should know. Okay. So what another aspirant is highly likely to know, and which is definitely a topic with a high strike rate, that I should be knowing. So I think it is important to focus and prioritize. Yes, Karthik. Next slide, please.
Yeah. So just taking you through the resources that we are providing through DocTutorials. So many of you will be already familiar with this long videos, elite test and discussion with more than 300 questions discussed from each faculty of respective specialty. Then you have the Harrison tables and flowchart video discussion. And rightly coming up is the 22nd edition update videos. I've already recorded. Browser has also recorded the videos. We'll be uploading into the app very soon. We have the revised QRP videos, QBank, Grand Test, both the live and the old ones. And very, very importantly, you have the WhatsApp group discussions being run by the respective faculty, and make sure that you are a group of the corresponding faculty run group. So we'll be providing the links of the common WhatsApp group at the end. So make sure you are a part of it.
Yeah, and why we are showing you this list is because we don't want you to miss out on certain key resources. For example, I'll just tell you one example. Allied T&D videos. Okay, I'm just quoting one example. As Dr. Karthik said, these are very important sessions that we do every year. And every year we do it with a different set of questions. So these MCQ discussion videos are ultra high yield videos. And I always tell students, just binge watch these videos. We have covered so much high yield content in that. Because if you have not noticed, in case you have watched the long videos, the QRP videos, Harrison table, but in case you have not touched upon this LITND video, if you have got time, I repeat, if you have got time, please go through it. It's all about prioritizing the resources right now. That's what I want to let you know. Yes.
Yes. So we will be starting off with a very, very common question encountered by myself and Rahul sir. Sir would also agree. So because the Harrison 22nd edition has been released a couple of months back, a lot of students are having an apprehension that, sir, I've already prepared using the 21st edition. So will I have to go through afresh through the entire 22nd edition? What are the updates? So is the Harrison 22nd edition a game changer, or is it just a little or a gentle upgradation over the 21st? Let me tell you, it has got only minimal core changes. And when we were analyzing the new textbooks, 95% of the content was identical to Harrison 21st. So what is the remaining 5 to 10 percentage? Remember, those updates have already been published in the literature in 2022, 2023, which were not being covered in the previous edition. And can very confidently say that almost 90 percentage of the updates or the change which has been made in Harrison 22nd are already being integrated, are already existing in the long video discussion, the new QRP, and the WhatsApp group discussions that we have been conducting in the last few years.
Yeah. I think
And
it's very important not to panic because I've seen many candidates panicking. Sir, should I go for a fresh reading? Let me tell you, if neurology is concerned, very minimal changes. So don't panic. If you have done 21st, that is fair enough. Just listen to the faculty update videos that are going to be uploaded and also the WhatsApp group discussions that will be very active from now on. Yes.
yeah, and one more point I have to emphasize, at least from the endocrine point of view, even for INI-SS, the Williams 15th edition was published, and at least two INI have passed after that. And there has been not a single question which was based on an update from the 15th edition. So NEET and INI-SS rarely they test your knowledge on the brand new edition. Rather, they would focus on the concept, the stable Harrison and Williams table, which have been there for some time. And of course, the guideline driven questions are important. That's why Sir has also emphasized to be an active part of the WhatsApp group discussions, because we would be updating you real time on the newer changes and updates which have been occurring in medicine.
Right.
Yeah, this is one challenge while we are conducting a session like this, because we have a unique set of students who belong to different categories. So there are students who have devoted the entire an year right after the NEET-SS to a dedicated preparation till the next exam. So they are year-long dedicated preparers, we like to call, or in other words, they are like marathon runners. They have been working consistently hard for the past few months or an year, and now they would like to finish strong. So this group would be very much different from the fresh MD or DNB pass outs. So who have minimal time for a detailed preparation. So they would like to have a sprint. So if the other ones were marathon runners, they are going to be sprinters. Then you have the non-medicine streams who have not done MD or DNB medicine, would be coming from MD, DNB pediatrics, could be from gynecology, could be from pathology, like that. So those students would also have to go through that hurdle of reading Harrison and solving the medicine MCQs. And some would be forced, or some would be rather of would be giving the NEET-SS while they are actually doing some work. They would be running their clinics, going for duties, and they would be able to devote only lesser time compared to the other three groups. So you like to address each of these categories separately so that you can decide for yourself which category are you belonging to and how would I tailor my preparation to. Okay. So first, I would start off with the marathon running students, the year-long dedicated preparers. So what are their strong suits? So they have already gone through most of the Harrison. They have a strong syllabus coverage. If they are closely following the app, they might have already gone through the long videos. They might have prepared their own notes from Harrison and the videos combined, and they may have already have done multiple cycles of revision in the last year. And what is their focus right now? They have to maximize the recall of whatever they have learned and have to minimize the error rates because they cannot lose it at the fag end. They have worked hard for such a long time, they should not lose it towards the end. Rahul sir, how they planned their preparation in the last couple of months?
I think, you have beautifully put in, the profile of the aspirants. Now, in their case, I think from now on, as you have shown in this slide, there is no need to go for too much of video lectures from now on, like watching the entire lecture again. And if at all they need some top up, it's basically watching the QRP videos, maybe to refresh. Rather than going through the entire video of a topic like ataxia, they can just go through the revision videos alone, and also the Harrison tables. So the high yield content, more crisp content is what they should be looking at from the video point of view. Now, regarding MCQs, now this you have to be aggressive. And I'll tell you why you have to do this. 150 to 200 MCQs per day, which can be from the Q bank or the grand test that you are actually doing, but make it a point you are practicing enough MCQs. Why we are telling you this is because NEET-SS, believe me, if you look at the last 5-year papers, there is not a predictable pattern unlike INI. INI is slightly more predictable compared to NEET, which means I have personally seen exams wherein, it was very easy, straight lines from Harrison. I have seen exams which have been difficult as well with lot of image-based questions. So I want all of you to be mentally prepared for whatever comes your way. Now, for that, you have to expose yourself to more number of MCQs if you feel that you have done adequate syllabus coverage. Now, many students ask us, sir, how should we split the time between the theory content and the MCQs? Now, for this particular profile, people alone, listen to us, year-long dedicated preparers, 80% of time, up to 80%, you can devote for MCQ practice because you are already done with the syllabus quite thoroughly, and 20% with the high yield notes and videos. And more number of revisions you do will always be good, because sometimes what can happen is you go for dead slow reading. And as always, you have heard it from your NEET PG or INI-CT preparation days, the more number of times you go through your notes, the better that is. So that is what we would like to suggest to the, dedicated preparers. Any more points, Dr. Karthik, to add?
And yeah, sir, as you rightly pointed out, doing GTs is also important. Trying to
Yes.
solve questions in a time-bound fashion, because one of the challenges faced by those who have given the NEET-SS 2024 was that the questions were divided into 3 blocks. So and one of the blocks, they had a more of a lengthier questions, more difficult ones. So they have been found wanting for time. So you have to
Yeah.
make sure that you are getting the answer correct in that limited frame of time also. That's important.
Karthik, I've always seen candidates asking me, sir, I've not finished my portion. So should I give grand test maybe once I'm a bit more confident? Please, no. I feel you have to give the grand test. If at all there is, you have got some weak points, it's better to get exposed right now rather than towards the exam, which might stress you. So that's what we want to tell you, right?
Yeah, correct, sir. So we're moving on to the second group, the fresh MD and DNB pass out students from medicine. So what are their strong suit? They just cleared the MD DNB exams. They are assumed to be stronger in their theory part, but the problem is that they only have a short window which needs consolidation. So even though they are strong in theory, that would require a bit more of reshaping and to be tailored to the need of a MCQ based exam. So they have to focus on exam style practice question, because they would have done very little while they were while they were training for their final theory exam and for practicals. So focusing on exam style practice question is very important. And going through selective revision, because they need not go in for long videos because they are already fresh from the theory. So focused revision, focusing more on the high yield videos that sir will be describing about how these group of students would be going about in their preparation.
And I think, Karthik, maybe I was in a similar position when I gave my NEET-SS exam. And I'm sure I think you were also in the same position,
Yes, sir.
wherein my exam came just 1 month after the MD finals. So I'll tell you very honestly, I initially had a self-doubt that whether this theory preparation that I've done for my, the university exam is enough. So I had this self-doubt and what I should be doing in the 1 month. Should I go for some videos? I was not at that time, we did not have the apps, but I was just thinking what to do. Should I go for MCQs? But then what I understood is, see, I've got to trust the knowledge that I've gained. Trust the knowledge that I've gained through the last several months for my university preparations. And I felt that at that time, the top up that I needed was getting to this match practice, that is the MCQ mode, shifting from the theory mode to the MCQ mode. And I'll tell you, 1 month I aggressively solved MCQs, and actually that gave me a good rank as well. So as said in this slide, I don't think you should be going for long videos, but if at all you feel that, look, my hematology is a bit weak, I just want to go through it, or my endocrinology is a bit weak, go through the QRT videos, very concise, crisp videos you have got in the DocTutorials app. Spend 2 to 3 hours a day for the video part. MCQs, again, aggressive MCQ practice. Now, if you are someone who wants to get to the MCQ mode, I will strongly suggest the LI test and discussion videos. For those who do not know, basically these are questions that we have framed ourselves as faculties, and we have discussed our approach. For example, a clinical scenario-based question on endocrinology that Dr. Karthik is discussing, he discusses how he thinks and he approaches that particular question. I think for you to shift to an MCQ mode, that will definitely help. You have to have a decent time split with 50% MCQs plus 50% high yield notes or videos, whichever you are comfortable with. Target is to do at least 2 revisions, but whatever GT is coming your way right now, whether you are underprepared or not, you have to give. That is what we want to tell you. And again, please from now on spend your entire time for preparation. Because Karthik, many students ask me, sir, can we do some part-time work also right now? Well, if your financial situation is demanding that, fine, but otherwise try to have a full-fledged preparation. That's what I would like to tell you, right?
Correct. Yes, sir. So again, another challenging group to encounter, the students who are coming from non-medicine stream appearing for the medicine paper. So their profile would be, they'll be having certain knowledge gaps in adult medicine. They would be proficient in their own specialty, but while approaching medicine, there would be some knowledge gap is what we assume. And they would have less Harrison exposure because it has not been the textbook that they have been following through their residency. So their focus now would be to build foundation in core medicine. So there are certain areas of medicine which you cannot get away with. You should know, and they have to build the foundation on such areas, as well as simultaneously on hand in hand, they'll have to go about practicing MCQs also. So this is one group where we would advise you can actually go through the selected long videos for weak areas, right, sir?
Yes, absolutely right. I'll also totally agree with that, because if you do not know how to approach a stroke and manage it, for example, when a patient comes to the emergency, how are you supposed to investigate? What are you supposed to look for? And what are the thrombolytic agents that you can use? Can you use streptokinase or only alteplase, tenecteplase? You have got to know those basics. So you can go for selected long videos. And Dr. Karthik, one suggestion I have got is, for them, going through the previous year questions will definitely help, at least to understand what are these areas from which questions can come from. I agree that NEET-SS is not very much predictable, but at least the last few years paper, which is already there in the DocTutorials app, we have done recall videos, those questions will actually give you an idea. Okay, these are some areas which are very important, and why not give more importance to those videos rather than going for a full syllabus coverage is what, I would suggest. And for them also, if you have got, say, difficulty in certain systems, because I've seen, people having trouble with neurology and cardiology, especially those coming from the non-medicine stream, I think watching the Elite MCQ discussion videos also will definitely help to refine your approach. Yes, Karthik.
Yeah. And of course, you have to divide ample time. You may have to divide more time for theory, but again, at least 30 to 40% of your time you should devote side by side for practicing MCQ.
I think this is also one mistake commonly, such people make, because I've seen them, they keep reading because they've got a lot of portions to cover. But in the quest of reading more and more, they neglect practicing MCQs and doing grad test because they feel that, sir, my syllabus coverage is not enough. But I'll tell you, NEET-SS, there are a lot of seats available, right, Karthik? Unlike INI, there are a lot of seats available. So if you can put in a decent performance, you can definitely anticipate a decent rank. So don't lose hope. You've got enough number of seats for NEET-SS in comparison to that of INI is what I would say. And the target is at least one full round of selected long videos, as we said, plus MCQ practice. Please, you have to put in good amount of time for your MCQ practice. And I think the QRP videos, the revision videos, definitely in the DocTutorials app is definitely going to actually help you, right? Okay.
Yeah, correct, sir. So coming to the fourth stream, I apologize for the mistake in the title. It's actually those students who have to simultaneously practice right before the exam for the last couple of months. Again, I'm echoing Rahul sir's words. If at all possible, try to be a little away from work little, and try to spend more time, at least 8 to 10 hours per day for study. Okay, so in such individuals who are forced to work before the exam, they working practitioners, they can spare only 4 to 6 hours per day maximum, but they will now have to focus and spend time more effectively and in a smart fashion by highly selecting.
For such people, it's always better to, assume that the universe will actually help you, because sometimes, you tend to think, I'm only preparing 4 hours, 5 hours. These guys on screen are telling us to prepare 10 hours, 12 hours. So don't you think I stand a chance? See, you have been practicing, you have got some basic knowledge, and always you have got to have that positive attitude. Look, it may be true that I've got less time, but why not try my best? What if, it is my day? Because as we all know, a bit depends on luck as well. So never underestimate yourself. Within the limitations that you have got, please try to give an optimal performance. That's what I want to tell you. Yes, Karthik, please continue with this. Now, the previous, I think we have not discussed the remaining points in the slide as well. The previous slide, please. Yeah. So for the working practitioners, again, for the video lectures, try to be more precise, focusing more on the QRP, the Harrison tables and flowchart videos, and the Elite TND videos. Please practice adequate MCQs. The more time you can devote for your preparation, I think that will be better. And please try to give grand test as well, because only then, you will be conditioned for the actual exam. And especially you have to familiarize with the time slots, and you have to finish accordingly as well. So more time for MCQ practice and around 30% time for high notes or videos. Okay, right.
And again, study time division, again, it's a matter of controversy because it differs from candidate to candidate. But minimum of 8 to 10 hours per day, you have to devote in the last 2 months, because this is a very crucial time. You have been assimilating information.
Karthik, I would say bare minimum. Bare minimum. Okay, bare minimum. Yes. Because, even if you can study 25 hours a day is also good. Okay, you have to find some reason, because I can totally understand, unlike NEET PG or INI CT preparation days, we have all got responsibilities. And as I take this session, I have kept my door locked because my kid will actually walk in right now to disturb the session. So we have got all, responsibilities. I totally understand that. But in your capability, what is the best that you can do? That is what you should be doing. And but take a proper sleep as well. Don't panic too much. After all, it's an exam, and there are 2 INIs every year. If at all, imagine the worst scenario, you don't crack NEET-SS, next April INI, you might be a ranked topper. You might get into some, the best central institute. So fortunes can always change. So do not consider it as a matter of life or death. It is an exam, but you try to give your best. That's what you can do, right?
Correct. Correct. Yeah, again, coming to the question practice strategy, we've been telling minimum of 100 questions per day, but in one of the groups we have discussed up to 200 questions per day would be a fair share. And again, regarding the pattern of questions, we would be having a mix of clinical Vinay and one-liners. So it's always better to be like prepared for like whatever pattern that is going to come
Exactly,
for the exam.
exactly. Because it's very difficult. Because I've seen patterns wherein they've picked the hand-picked lines from Harrison. Sometimes clinical vignettes with a lot of images have come. So you should anticipate. Anticipate. It is very important, and you practice enough number of questions as well, right?
And of course, when you are doing the MCQs, it's not just about getting the options correct by guessing or something. You will have to know, because the question for the exam would not be the same thing which have there in the Q bank. It would be some point which is mentioned somewhere in the explanation. So it's very important that you know the explanation or the concept behind that, rather than just guessing and getting the questions correct.
Yeah, and there's one quick question that I'd like to answer. LIT&D sessions. One candidate is asking, should we watch the current session or the previous sessions only? So let me tell you, every year, as far as possible, we try to go for a fresh set. Every year I make it a point, okay, the previous session question should not come. So that means every year LIT&D is a separate resource in itself. Do you agree to that, Dr. Karthik?
Absolutely, sir. Absolutely.
Yeah, so what we would suggest to you is, as much as Elite you can watch, it'll always be good. See, Elite is a different league of questions. I can easily put some questions for Elite directly from what I have taught in the exam, but that's not what I've done. I want all of you to familiarize with all sorts of questions. Now, if you look any subject, medicine, endocrinology, neurology, cardiology, you will see all sorts, all range of questions. So you have to be familiar with that, because see, sometimes the exam might be very tough. Sometimes it can be easy. So you have to familiarize or acclimatize with whatever comes in your way, right? Okay.
And again, sir, this just point that we have been discussing, you have to focus on the explanation than the answer. That is exactly applicable for the Elite video discussion. If you look into the discussion of one question by Rahul, sir, you would get another 15 MCQ points from that discussion of one question. So that is one, you will be covering a whole lot of area and whole lot of questions by just watching the discussion of one single question.
Right, right. It's very important, because, it's like, if you look at the last few years, LIT&D, I can confidently say that almost entire neurology I've covered through those videos. Every question is representative of a topic. So that is what the utility of these LIT&D sessions are. And I've seen last year as well, the NEET-SS toppers, Karthik, you would also know that they've been binge watching the LIT&D and the revision videos. Towards the end, I think the game changers were the revision videos and the Elite test and discussion videos, right? And also, when you, just like Dr. Karthik said about the reviewing the mistakes, it's very important. Many a times you give a GT, okay, find your score and leave it. Please go through the mistakes. Where have you gone wrong? Is it a problem with the content that you have got, or is it like you've recollected wrongly, or whatever it is? You have to make the error correction rather than just going for an assessment alone, right?
Yes, sir. This was one thing which I was doing while I was attempting for the exam, sir. I would keep a notebook just for the questions and the points which I could not recollect correctly, and the questions that I've gotten wrong. So because
Right.
we are more likely to get it wrong one more time also when there is a close call between the two options. So it's
Right.
always better to keep your mistakes that you have made closer in your mind and revise them regularly, so that you are not going to make that same mistake in the day that matters.
Yeah, and one more query by a candidate, for the medical group, should we focus on oncology also? My dear friend, though there are separate groups for oncology, pulmonology, questions can come in the NEET-SS paper as well. It has come before. So it is very important, Karthik. I think in the sessions that we have done, I think you should go through those videos as well. Myself and Karthik, we have done the analysis video of NEET-SS 2024, which is available in YouTube. We have shown you the question distribution for 2023 we have done. So Karthik, don't you think going through Palmo, Onco, at least the
last time also there were 8 questions from oncology and 6 questions from Palmo.
So don't think that, since you have got a separate group, questions will not come. It's not like that. Okay. Right.
And about the prioritization of topics, all specialties to be considered equally important, which we are very well aware by looking just through the question distribution in the previous year NEET-SS. 22 and 23, we just had 8 and 10 questions from rheumatology. And what happened in the last session, there were around 25 to 26 questions from rheumat specialty alone. So it changes every time. It's not the 15 questions per each specialty. So what do you think, Rahul sir?
So see, what I think is, if you can go through the sessions that I said, wherein we have compared the previous NEET-SS, we have seen last NEET-SS, there was predominance of rheumatology and medical gastroenterology, which was not the case before that. We have seen sessions where almost nil, no questions from hematology. The immediate exam after that had good number of questions from hematology. So you have to consider like that. It's not like that one is a major system or a minor system, everything is important. The last NEET-SS had less number of questions, only 11 questions from neurology, whereas the previous NEET-SS, one of the most dominating branches were neurology only. So that actually keeps changing, and you will have to consider all the specialties to be almost equally important.
And sir, a very, very hot question from the candidates. We have NEET-SS by around November 8th, and 2 weeks later by November 25 is where you expect the INIs to happen. So how do they face the preparation? Like, should they wait for INI preparation till the NEET is over and then focus on the specialty alone for the next 2 weeks? Or how do you go about it, sir?
Yeah, I think this is a common dilemma that many candidates have, and it's a common query that I've been getting as well. Now, if you are a candidate, I personally know many candidates who are only focusing on INI. Dr. Karthik, they are giving the NEET-SS, but they are actually preparing for INI only. For them, I think the goal is clear. It is INI, but the NEET-SS is just like another grant test they are giving. And also the NEET-SS medical group preparation will help them for those 25 odd questions that you will get from the medicine segment for the INI as well. Because what I want to tell to the serious INI aspirants as well, if you're targeting INI endo or INI neuro or whatever, we have seen papers wherein the subspecialty questions were relatively moderate, but the medicine questions were slightly more tough. So don't underestimate the medicine questions, and you have to prepare accordingly. Like suppose if you're preparing for INI endo with a clear frame of mind that this is your primary target, you can stick with that, and your preparation can be 70% your INI topics and 30% to the medical group topics, provided you are clear that INI is what I target. But for a large chunk of students, I'm sure that you will be stuck. I want to give NEET-SS, but again, INI is always a dream that I've got. For them, I would feel that, look, NEET-SS has more possibilities compared to INI, and that is the first exam to come. So that will be my base exam, and I have to give a full-fledged preparation for NEET-SS. And the remaining 2 weeks from NEET-SS to INI, I will focus mainly on the recall videos. For example, I'll tell you what I would have done. Now, strategy can vary. Even my opinion and Dr. Karthik's opinion can vary. But what I would have done is, if my main aim is NEET-SS, but again, I would always like to get an INI seat as well, I'll prepare well for NEET-SS. In those 2 weeks between NEET-SS and INI, I'll go through all the INI recall videos. For example, Dr. Karthik, you have done the INI endo recalls. So you have covered a lot of topics. And don't you think that just going through those recall videos alone will actually, give them, okay, this is exactly what is being asked, and you have discussed points in and around that. So my advice for those group of students will be, keep NEET-SS as a base exam, because that is the first exam, and you don't want to get demoralized as well. That should be your exam, and those 2 weeks focus on the INI PYT, not PYQ alone, previous year topics, which you can go through extensive recall videos. For neurology, I'm very confident that, the recall videos, if you go through it, suppose there is a question based on a monoclonal antibody. I've given a big flow chart on all monoclonal antibodies. So I think it is very, very imperative that you have your focus right. Because if you don't focus well, if you give 50% attempt here for NEET and then INI, then you are confused, you don't have clarity. But if for the latter category that I said, NEET-SS should be your base exam, and those 2 weeks should be aggressive preparation for INI as well. Dr. Karthik.
Exactly, sir. Very clear. So, summing up what we have been discussing in the last 30 minutes or so. So, the rank, of course, the preparation is important, but it is essentially built on revision. So, please don't lose your head. Please don't lose your focus in these last couple of months. So, should not be a lot of fresh reading in the last lap. It should be focused on revision itself. So, believe in your preparation. You already know more than you think. So that will come to your help in the exam day if you revise it well in the last couple of months. So the consistency in the last 60 days can actually change a whole lot in your rank. And me and Rahul sir can assure you that DocTutorials will be with you till you reach your finish line.
And I think it's very important to use those resources. Even last year, Dr. Karthik, I know that people were overburdened with, multiple random videos here and there. But finally, everyone went for the QRP and LI test and discussion because they were not, finishing the portions feasible. Everyone came to DocTutorials for the LITND as well as the QRP. I'm not saying this as a DT faculty, but these that we have got as LITND, QRP, Harrison table, very unique in the DT app, and that definitely will actually help you as well. Some quick questions we'll just take. Arjit is asking, any chance of exam shifting? Arjit, I'm sure that you would have also followed National Board for some time now. And I think, you're so cruel to ask me this question. Nobody can predict what National Board is going to do, correct? No? So as of now, we have a tentative date. Prepare accordingly. If at all there is some postponement, do I know? Absolutely, I've got no idea. I am as ignorant as you are. For me, this is the date that has been announced right now. I think it's better to focus on that date. If at all there is some sort of a postponement, it is only giving you some additional time of revision. But don't anticipate postponement, then you might be disappointed, is what I want to know. Harin, GT score for a rank of 500, I would always suggest, target 120 plus correct answers in your GT. Target 120 plus correct answers in your GT. As I said, the number of correct answers can vary based on the difficulty level. We have seen exams where the topper gets 120, but I just said target 120 for your grand test. Because only if you get 120 plus for your grand test, you might get 115 or something for your actual exam. That's what I said. Target 120 plus for your GT. Target. You might fall short, but that's fine. You target like that. Okay.
And so there is one question: how to solve 100 questions a day? Does it have to be topic wise or as custom modules?
So that depends. I think, it is based on the way you actually prepare. As we said, suppose, you have just finished your MD, DNB finals. You want to quickly go through cardiology MCQs. I think in DocTutorials, we have got the QRP Q bank as well. If you have got shortage of time, not able to go through the entire Q bank, you can go through the QRP Q bank for more precise, concise solving of questions. That's what I would suggest. Okay.
Dr. Susmita is asking how to give time to super specialty book tables like Williams for INI-SS endocrinology while preparing NEET-SS. So I think
if you're the best person to answer that, but I think I'll always tell you, if you have listened to his lectures, there is absolutely no need, I think, because whatever is essential, Karthik, I'm sure that you have covered in your lectures, right?
Yeah, correct. If at all you need, you can just make a PDF of just the tables in Williams alone. But even the most important tables I've already included in the lectures. So if you have gone through the lectures and made a notes, I don't suggest that you have to go to the Williams separately and read it from cover to cover. Or even the important tables, I have everything which is a potential question I have included in the videos, or at least in the revision videos which have been published lately. So I don't think you need to do it separately.
Yeah, before we move to the next question, can you just show the target NEET-SS? Because some aspirants might be watching us late In case you have not joined the target NEET-SS WhatsApp group, please be in these groups, because last year also almost every seriously preparing medical group aspirant was there in our WhatsApp group. And this time also we'll have, and the next couple of months the group is going to be more active, because as always, every year it's near to the exam that we discuss more and more points. So we have got dedicated separate subject specialty groups as well, and this is the common group target NEET-SS. You please join this group. In case you are suppose the group already gets filled, you can just send me a WhatsApp, send me a message in Instagram. The QR code of my Instagram page is also shown. So what you're seeing on the left side of your screen is the QR code of my Instagram page, and on the right side is the QR code of the target NEET-SS group. If you're already there in the group 1, then there is no need of joining group 2, but make sure you are there in the 2025 group. We already have got a few 2024 groups, but the active discussion will take place in the 2025 group. So please be in the right group. Karthik, we can go to the previous slide.
I think there is one more question, sir. Like one of the students is asking how to cover all the systems in this last 2 months and how to give GT accordingly.
So I would say, it is important to, make some progress rather than target perfection, as I told you. But what I would suggest to you is not to drop a system. At least go through core areas of all systems rather than covering only selected quest systems. For example, Karthik, last time, Rumet Gastro had good number of questions. So suppose, you go through neuro, cardio thoroughly and skip the Rumet and GIT part, then, you will be surprised to see so many questions from Rumet and GIT. So I think from every system, identify the core topics and go through the core topics is what I would suggest. And also please devote more time to your preparation so that, the yield also can be better. Okay.
And so again, how much time for each specialty depends on what is your background strength and knowledge. Exactly. So some would have to spend, say, 5 days to 7 days for rheumatology, and some would have to spend 1 week for entire specialty. That again depends. That we have to like analyze your own strength and weakness and decide accordingly.
Right. And should we give GT on a weekly basis? I think that will be a good idea. If you give more number of GTs, that will be nice. And Karthik, if you look at the INI toppers, I took interview of 2 INI toppers, and the rank 1 gave every grant test in the app, including the previous year's grant test. So she said that whatever GTs are there in the app, including the old GTs, she has actually done that. So doing more number of GTs, I think toppers usually do that. I think you should also actually do more number of GTs. Okay, right. So Vijit is asking, INI-SS Q bank necessary for NEET-SS aspirants? I think you can prioritize. If you've got additional time, well, maybe, but otherwise stick mostly to the NEET-SS. But again, it is based on, whether you have been preparing for some, maybe one dedicated year. In case you have got time, that won't be a bad idea as well. Okay. So Mithali is asking, so we have got our theory exam by September end and practical by mid-October. What is the right mindset to keep during this phase, as everything is jam-packed in the 2 months timeline? I totally understand that you have got a hectic schedule, but what I would suggest is focus on your exams, focus on your exam. Don't be mentally too much stressed. It is understandable that you have got little time, but all that you can do is those 2 weeks, aggressively go through the previous year NEET-SS topics. At least that. Okay, since you have got very less time, immediately once you're done with your practicals, you see what are the NEET-SS topics being asked in the last 3-4 years, and you study those topics thoroughly. And that will actually help you, because in your case, time is pretty much limited. That is what I would suggest. Okay, right. So Lasya is asking, can you please provide a schedule covering all systems? Lasya, I think that depends on person-to-person basis. For me, neurology might be easy, or another system might be difficult. For you, it might be the other case. So I think, but if you can just give us a schedule to any of our faculties, maybe, myself, Dr. Karthik, we would be happy to advise some suggestions for that. Okay, but to have a common size fits all will be difficult, because it depends from candidate to candidate. That's what I would like to tell you. Okay, right. Anonymous, one person is asking how to overcome the plateau phase in GT. Make sure that you are reviewing the GTs better. What you should do is last 5 GTs. What I always advise students who actually have this plateau phases, take the last 5 GTs Identify the topics that you have gone wrong. Topics, not the questions alone. And every day, spend some time revising those topics because those are your weaker topics. So, as Dr. Karthik said earlier, a mistake that you have made in a weaker topic, you are more likely to get confused by a related question that comes from the same topic. So that is what I said. Identify the weak topics over the last 5 GTs or 3 GTs that you gave, and every day spend some time for your weaker areas. So once you actually go through it, I think you are definitely likely to see some improvement. Okay. So Vijit, any upcoming GT on image based or tables based on Harrison, I'll let you know regarding that in the group. Okay. Partha is asking WhatsApp groups are full. We'll be forming new WhatsApp group. So don't worry. You can just send me, Dr. Karthik, if you can show the next slide. Yeah. So this is my Instagram. If in case you are watching the session later as well, you can just send me a message over Instagram. I'll be sending you the link of the target group, the new group that we'll be forming. But I hope today's session was useful for all of you. What we have tried to do is, rather than saying a common message to all of you, we have tried to, divide into categories and category specific suggestions, we have tried to give you. And any last insights, Dr. Karthik, that you want to give to the students?
Yes, sir. Again, like 2 months are very crucial. Like you have to like plan your schedule. Like I would be like focusing on to cover at least 2 specialties a week, like that specific small target. Again, you have to divide this 2 months into small time blocks. So you have to decide how many revisions that I'm planning, either 2 or 3. If you're planning 2 revisions, how much time do you need for your first revision? Like if I take 1 week for covering 2 specialties, how much will it take? What are my stronger suits? What are my weaker suits? You identify your strength and weakness, devote time for each specialty accordingly, so that you would have a smooth run and you would be comfortably able to do at least 2 revision simultaneously along with good MCQ practice. So understanding your strength and weakness and do the planning accordingly would be the most important. We can only advise you, but it is yourself who would be the best judge and assessor of oneself. Okay.
Yeah, and I think we'll be doing some strategy videos for the exam day later, maybe close to the exam. We'll be doing maybe 1 or 2 sessions for that. So you can stay tuned to this YouTube channel of DocTutorials as well. So a couple of questions. Is it really possible to study and crack in first attempt for a fresher after final year theory practical exams? So both of us have done in the same way. Myself and Dr. Karthik immediately 1 month after our exams, we had the NEET-SS, and we are not exceptions. There are many. We are not exceptions. There are many who have done it, but I think you have to just trust yourself. You might have a lot of self-doubts. You might think that people have prepared for 1 year, but again, it's all about believing in yourself and what you have prepared. And especially once you have done with your MD or DNB finals, I always feel that you're at the peak of your knowledge. So only thing is that you have got to get fine-tuned to that MCQ solving mode. So it's not that you are having any problem with your content. It's just that some fine-tuning is required. So that is what I would suggest. Harin is asking for GT, should we do only incorrect question or all? Harin, again, depends on the time that you have got, but incorrect question, most important. Please review the incorrect questions first. And once that is done with, if at all you have got time, you can go through the others as well. But always value your time, Harin, and it all depends on how you can prioritize your time. But again, let me tell you, as always, just like your NEET PG days, INI-CT days, it's all about the effort that you put in. You have got to put in some genuine effort, and only that will actually give you the results. And also, let me tell you, the last 10 days are going to be very crucial. What you are going to revise in the last 10 days, you have to plan right now, because those 10 days, if you can assimilate, that's the final mini revision. That's what I call it, the final mini revision. Those 10 days, if you can revise well, if you can consolidate well, because many students, they extend the last revision till 1 or 2 days before the exam. But if at all there is a possibility, I would always suggest to you, do a mini revision for 10 days just before the exam, because that is the final consolidation and you will feel more confident as well. So that's it. Somebody is asking, is it really possible for an average people like me, as I've not covered much theory for finals? See, what is that you should do? you should try to convince yourself that, look, I may have limitations, but I'm trying to do my best. There are good number of seats in NEET-SS. It's not just rank 1 or 10 that gets the seat for NEET-SS. You have got so many good institutes, and I think even a decent performance will actually get you to your destination. So it's not always necessary to be an MCQ topper to, to be the best. I think, you all should try to do your optimal performance is what I would suggest to all of you. So, Karthik, I think we shall close the session. Anything
Yes, sir.
you
Yes.
want to add?
Yes.
So, to all the aspirants, let me tell you, we are always there with you. The WhatsApp group will be more active now. So please be active in all our WhatsApp groups. And, thank you so much, everyone, for joining. And let's try to give the best attempt for the NEET-SS and the upcoming INI. We'll be coming with more such sessions as well. Thank you so much, everyone, for joining. Bye-bye.
Thank you. Thank you. Good night.
Thank you so much.